So go ahead and open up the TM Flow software, right into your password. Go to settings. Always go to settings first.
I need to get this thing off. Hold on.
Yeah, I don't know why.
Next.
Now, so everything's paired. That's how it always needs to look.
Okay.
And I'm going to take your word for it that all of the cables are plugged in correctly. If there's any doubt on that, then what we would do is we would do the GSR device testing, and that is when we attach the electrodes just to your hand and ran that, and then that establishes that there's actual the connections there. But I remember us doing it last time. If you haven't changed it, then we should be fine.
Okay.
So go ahead and hit save and exit.
And exit.
And then let's do a new patient. So add new patient.
I'm blind this morning.
It's all right, okay. Right in the middle. Yeah. All right, and now you're going to fill out this information. Now it's a pain in the butt because they've made it to where you have to put in a email and phone number and address for every patient. You can kind of make those up if you want. The only thing that's very important is that you get their name, date of birth, and gender correct, because that's going to affect the actual measurements, right? Because the algorithm takes those into account. The other information, obviously, you want to put in accurately. However, if you're doing, a lot of offices just get really, really pissed off about having to put in a separate email for every patient because they say their patients don't have emails. So
okay.
There's a way to maneuver through that. Just make up a BS email if you need to. But
okay, Sheila, can you come here, please? Wait, ma'am. What is your last name?
Curl, C-U-R-L.
Just put like our address or.
Sure.
Yeah, just do whatever you got to do.
Morning, Sheila. Good morning.
I don't know how to type here. 5. Isn't it Silver Creek Road? Okay. Oh my God.
442.
Huh?
86442.
Oh, look at, I don't even know what I'm typing. Goodness. Okay. Your work email or something. I don't know. What's your work email here?
Oh God, I don't know, but you can put my personal if you want. I don't care.
Okay, what is it?
It's Sheila, Sheila, Curl at gmail.com.
And then what's your date of birth?
5/10/52. My true age. Don't you dare tell anybody.
They can all.
This is recorded and it's going to post online.
Okay.
Okay. So now these are the contraindications. So if the answer is yes to any of these, you can't do the test. Okay.
Okay.
There's one
you don't
other.
have a defibrillator or any of that.
No.
Okay.
There's one other contraindication. So you might want to basically add these to your intake form, but also. There is one other. If the patient has with the eyes, I'll look it up. But because you're
like
doing
cataract.
No, it has to do with pressure in the eyes.
Macular degeneration.
Something. You have like if you're doing 4-cup ABI, you're doing a lot of pressure on their body. You just don't want to do anything crazy to their eyes. I'll look it up. It's in the training manual.
Kristen, did you hear about putting it on the intakes?
Did.
Oh,
yes, I did. Sorry. I've got, remember, I've got everything on mute. There's way too much noise where I am, so I don't want to be bothering you guys. So, yes, I did hear that. I have a intake form that Thomas has sent that Doc and I, as we always do, are manipulating to his specifications. I'll make sure I add that to it.
Okay. So we're putting. You don't have any of these, right?
What is that? I can't see that.
You don't have a defibrillator, pacemaker, mastectomy.
No.
Okay. Oop. Missing limbs.
No, I think they're all intact.
Okay.
Okay. Inputs that are imperative are height, weight, and daily activity level. However, the rest will be helpful when documenting your patient encounter, right? So you can put the lab tests. You can add their symptoms. You can add their disease and their treatment that you're already kind of working with them on. But in order to get through this screen, you just have to put height, weight, and daily activity level. So go ahead and put that in there.
We have to put these for her?
You have to put height, weight, and daily activity level to get through to the next screen.
Oh, okay. I've already done that one. Okay.
Okay, go ahead and click continue.
So
Do activity level, daily activity level.
where is that? Oh my
It's
God.
right under H.
My mouse.
Like a red underweight. So
Yeah, I see it. So what's your daily activity?
well,
Activity, office activity, 2 to 4 hours of exercise a week. Okay.
it just varies. I mean, I can do more when I.
And then on these symptoms and stuff, do we ask the patient that stuff, right?
Well, you're gonna have that from the patient intake form.
Okay.
Already?
Okay. I get you.
Know from the EHR what their chronic conditions are,
Okay.
right?
Thomas, I don't want to interrupt you. She can do most of this stuff before she ever brings the patient back, correct?
Yeah.
Yes, and actually, you can actually email this to the patient prior to the visit.
Or Tristan, we can give it to them when they leave and have them bring it back. Either way is
Yeah, the
Yeah.
intake forms. Okay. Right
Yeah.
arm.
So on the left end, this screen is really important. Okay, so this screen tells you how to do the entire setup for the patient. It's deceptively simple. Those are very important. Blue arrows are oriented with the patient body, of the cuffs, the orientation of the snaps and the electrodes on the feet, and the pulse oximeter are all very important. Now, before you get set up, let me show you on the left-hand side. You're able to select which test you want to run. We're going to run a full test, but if you ever want to just do an ABI, and soon if you ever just want to do an ABI by itself, you can. If you ever just want to do ANS. Also, if you have a patient who's for the arm cuff, then you can swap that out for the large arm cuff.
Is that the one in the gray bag, right?
Yep.
Okay.
And then also, if you have an amputee, or if one of the cuffs happens to not be working or you can't get it to work, then you can run it with a missing extremity. Okay. So bench where, like, let's say your technician is like, oh my God, I can't get one of these blood pressure cuffs to work. It's killing me. You can just move forward without, let's say it's with the right arm cuff, just disable the right arm cuff and go ahead and move forward.
Okay.
And get set up. And then once you get set up, I'll help you spot check it, and then we'll hit continue. Okay?
Okay, she's just taking off her shoes real quick.
Oh,
I'm making her do the whole shebang.
all good.
All right. Hold on, let me get some.
combat pay for today. Don't worry about it.
Voicemail. So you know what? It works.
There.
Yeah, this is true. All right, so we're going. There you go. Make sure. Arrow, is it point down, right?
Yes, ma'am.
Okay, so I did have it right.
And on the ankles, you're gonna basically be rotating the ankle cuffs throughout the exam. So the first start pointing towards the big toe, the dorsalis pedis artery.
Right.
This one will plug because this one always swells.
These are so new that you know how they're super crispy at first.
Oh, that's good.
Boy.
What's going on?
Yeah, he turned the water off. I went to turn water on and it didn't work. So
Good.
yeah, it's not crazy, but
Oh,
it's so great. The alcohol pad or just the one. And okay, have first because
When the patient ready takes longer than the actual test itself. Is that factual?
No. They're about
she's sitting
really,
up.
you're probably gonna take 10 minutes to get the patient set up,
Okay.
and then you'll take about
Let me see where I have that.
15 minutes to run the diagnosis. Yeah.
To tear it down. And while they're doing that, the other thing, and we won't be able to do it today, I am sure, is I'm going to need to talk to someone about the professional components and how to do the reports and things like that. So
Of course.
we'll need to set up a time for you and me and Doc, or me and Doc and
Absolutely.
whomever.
Absolutely.
Now he's coming to me tomorrow and Wednesday, so we'll actually be on your side of the world. If you have time, either anytime tomorrow or anytime Wednesday for us to do those, now that there'll be a report in there, I'm assuming he can do the reports off-site, so he can log into this anywhere he's at, correct?
Yeah, absolutely.
Closer.
Okay.
Or actually, you're fine.
Okay. Then we'll set that up. At York, send me a meeting invite for Tuesday, Wednesday this week for us to do that.
Okay, cool. I'll put that in my notes. Anytime?
Anytime. He and I, anytime for us is fine. He's in Cleveland, so we'll be on Boca time. So whatever you want to do is
Boca
fine.
time. I like that. Boca time.
We'll be on Boca time.
Come in.
Go over report interpretation, not billing, correct?
If you want to train and have somebody on, we can do that as well.
I'm really not allowed to be doing billing trading, so
That's fine.
so we're just going to go through the. I was going to have Dr. Merrick.
We'll just do the report. That's fine.
I would have said something. Yeah.
All
Will
right.
you tell Nina to step away?
She's getting her papers.
Okay, let me.
On training. Get this one. Then pulse ox. Sorry. It's the gray pulse ox.
Great one, absolutely. Leave the red one off to the side for now.
Very good. Okay.
Okay, so let's just spot check. The black arm cuffs on the left, with the blue arrow pointing down towards the arm crease. Gray arm cuffs on the right arm, same thing. You've got gold on the left ankle and green on the right, with the blue arrows pointing towards the big toes.
Yes.
Shoes and socks are off. You have electrodes on her feet, with the red, green, and black and yellow. Left and right, left forefinger, and it's beeping.
Yes.
Okay, and we'll be able to tell if it's all set up correctly.
Software will have an measurement. Remain relaxed.
If we weren't set up correctly, you'd get an error message here. Okay. What's this? It's running the first ANS portion of the test, the pseudomotor, and sending a very small electrical pulse through her feet, detecting the C fiber sweat as well as the microcirculation. This corresponds to the 95923 billing code, and it takes about 2 minutes.
It's 27 seconds.
Okay. So now what we're going to do is you can go ahead and take the pulse ox, or not the pulse oximeter. Well, definitely you can take the pulse oximeter off her finger, and then you can also take the electrodes off her feet, and then we're going to run the TBI. So you can run it one of two ways. You can either use you're going to use the red pulse oximeter. You can either have it directly attach it directly to her toe, or you can use the blue, what is it called, in the diagram here. And it does have a little bit of a design tweak here, where it says you can either put it on the big toe or the second toe there. So, but we're going to start on the left foot, and then
that's the
the blue cuff. It plugs into the front of the pulse oximeter. And once it plugs in and you put it on her toe, it should start.
compared to the ones I've used.
Yeah.
Sure.
Could you wrap it around the toe? I do this. It's a little.
The left.
Oh,
Little on the toe.
interesting.
Yeah. Let's see. I don't know. I think that's
Well, this first one, once you get the hang of it quick, like the fast way through this is just to, but if you want to use this strap, then you're just going to learn how to use the strap right now. So that's why it's taking extra time.
I don't feel like it's on right, but how do we tell?
Well, it should beep.
Oh, it's beeping.
Okay, well, hit continue.
I'm thinking that.
Second toe as shown in the images. Wait for the oximeter wave to show on the oximeter screen, then click the continue button.
Yeah, so just switch to the other foot.
Please remove the
Okay.
oximeter from the patient's blood pressure measurement at the dorsalis pedis ankles and left arm. Click once the on-off button on each blood pressure device in order to, and then click OK.
Okay, so now we're going to run the ABI. So we run it twice. You're going to do one arm and both legs. You're going to rotate. You're going to do the second arm and both legs the second time. It gives you instructions and it talks at you, but I'm just kind of going to reiterate the instructions. So all you need to do, you put the pulse oximeter away, the other second pulse oximeter away. All you need to do is you just need to press the white button on the blood one time, so it says 0, and then hit OK on the screen. And you want to do it fairly quickly so that the Bluetooth doesn't time out.
Please wait for the.
Great, and she's.
That's your paperwork too? Okay. I'm gonna put you right here.
Segmental blood pressure measurements, tibial artery. The ankle cuffs must be rotated, and the arrow should be pointed to the posterior tibial artery. Click once on each blood pressure device to activate the Bluetooth. The screen should display 0. Then, click on the.
So what you'll do is you're just going to rotate both of those in about a quarter turn. You don't even really have to undo them. You usually just rotate them. The gray, gold, and green buttons and press continue. And that'll be the second. Great.
Please, and wait for the oximeter wave to be displayed on the oximeter screen. Then click on OK.
Okay. So what we're going to do is we're going to do the valve now. So we're done with the ABI and this last portion. Manometer that came with it. It's it should be in the box. It's like a mechanical device. Grab that plastic, or not plastic, but a cardboard mouth tip and put that on the end of it. And then the patient is going to blow on the end of that and try to reach 40 and sustain that for 15 seconds. Don't tell her to start until you've clicked start test and it starts counting.
Okay.
It needs to be on. Yep. It's the only thing that needs to be on. The gray one, not the red one.
Yeah.
I have no idea. It should just fit on the end of the trick.
That's all right. I just had to shove it on. So.
But if you don't even have, if you can blow on their finger, right? If you don't have that there, the point is just to get the heart rate up.
Okay. No, not yet. Now I can have her book.
Start the test first and then tell her to start, because it has a little bit of a delay and this is a little challenging. So go ahead and start now.
instruct the patient how to perform the test according to description. The patient can adjust his breathing by following the timer. Click on Start when the patient is ready to perform the test.
Yeah, so this one's really easy. You just hit Start Test, and then you're going to instruct her and out 5 seconds at a time.
You heard that?
This thing?
No.
You don't need the there anymore.
Shoot.
Electrodes have been removed. Procedure: instruct the patient how to perform the test according to the description. Click on Start only when the patient stands up.
Okay, so you're going to have her stand up, and you just need to have the pulse oximeter on her finger, and then you're also going to have the arm cuff, the left arm cuff, the black arm cuff. Yeah, and then you hit Start Test right when she stands up. I just started it for you.
Okay.
Because you want to catch that postural change. So right now it's going to take the pulse and blood oxygen saturation. And then once that's completed, you're going to arm the blood pressure cuff, and it's going to conduct the final blood pressure reading. And then we'll be finished.
Is that going?
Then, click on OK.
So go ahead and follow the instructions. Now you can go ahead and take all of the equipment off of the patient. And then show you how to access the report, and then we'll schedule our time for tomorrow or Wednesday to go through the report. So this screen shows that the measurement's been complete and it's been sent to the cloud. So you can go ahead and click on Open CCS Cloud.
It's really cool.
And go ahead and put in your email and password there. Save that. Oh, never mind. It makes you do all that crap.
No.
Yeah, go ahead and open the database. Yep. There's the report. So between the interpretation and results, those are the two. You can go ahead and hit up interpretation first. Oh, that's results. That's fine. You can do results too. Results here. This is where you're going to add your billing codes. You can also do reports from here. And so I would just to play around in here before our next call. You'll notice at the top, the tabs that say like Home, Dashboard, Databases, IFU, CCS Cloud Design, Marker, CCS Cloud, and Log Out. The IFU, CCS Cloud, the CCS Cloud Design, and the Markers, CCS Cloud are all PDFs, training PDFs. So again, the Markers is going to give you all of the interpretation training, and then the two cloud ones are going to give you the software training for the cloud. So again, if there's anybody who's kind of like interested prior to our call, you can go in there and you can download those PDFs and go through them. Go back to these and at the database tab, and I'll show you the window.
Tristan, there's.
Click on Open Database, magnifying glass. Where you're going to be able, the doctor's going to be able to put their notes tabs in the middle of the screen. Will take you to the different portions of the test where you'll see the markers. And then under interpretation, it has the automatic generated suggested interpretation that's editable, right?
Okay.
So I would just click through here before our next call, and then on our next call, I'll take you through all of the readings.
Okay.
Perfect.
All right, guys, you did a great job. Yeah, I'll send an email on our next training.
Fantastic.
Perfect, thank you.
One other question real quick. What is the website for me to actually go to?
Oh, ldtechcloud.com. It's right there on the screen.
Got it. Perfect. Thank you so much. And I'll talk to you either tomorrow or Wednesday. Just let me know when.
Thank you, guys.
Bye.
You're welcome.
Thank you.
Bye. Hey, Gabe, I'll go ahead and send me the link to that for how to train.
Okay.
And I'll talk to you in another minute. We'll see you on the next.
Got it.